Rocky Mountain spotted fever is another one of these infectious diseases that you have to know your geography. It's caused by Rickettsia rickettsii. It should be considered in the differential diagnosis of a patient with fever, headache, and rash. Well, a lot of diseases can cause that, so you should always have that as part of your differential diagnosis. More common in the summer months, and definitely you should get a history of tick exposure. Again, you have to know your geography. Even though it's called Rocky Mountain spotted fever, it's very common in the southeast, particularly North Carolina. So you're reading a test question, they say that the family was camping in North Carolina, something like that. You should start considering Rocky Mountain spotted fever as part of your differential diagnosis. More common in the April through September. Most children are less than 10 years of age, and it is associated with various ticks that can carry the rickettsia. The incubation period is about 2 days to 2 weeks. Then the patient will start with a nonspecific fever, headache, some myalgia, and sometimes some gastrointestinal symptoms. After the 3rd day, they'll break out with the rash. The rash starts on the extremities. Remember, a lot of these diseases that have rashes, you have to basically figure out where they start, the progression of them, and that helps you to determine which disease it might be. So with Rocky Mountain spotted fever, it'll start in the extremities, the hands and feet, and it works its way inward. It will spread very rapidly, and you can get these purpuric lesions. They can start as petechia, they can become hemorrhagic purpuric. They can actually cause areas of gangrene from vascular obstruction. They can have hepatosplenomegaly and also present with central nervous system findings. The diagnosis needs to be made, or the suspicion of the diagnosis needs to be made early so you can start treating early, or else you can have fatal outcomes. The diagnosis, you can send serology, so titers for confirmation. You have to treat as soon as you suspect it clinically, because while you're waiting for this test to come back, your patient's getting worse. One other helpful hint is that a lot of these patients will have hyponatremia. In addition to low white count, low platelets, look for hyponatremia. The treatment here is going to be doxycycline, or tetracycline. This is a little bit different than when we discuss the treatment for Lyme disease, that it depends on the age because we worry about tetracycline and staining of the teeth and things. When it comes to Rocky Mountain spotted fever, you treat everybody, regardless of age, with these antibiotics. A short course will not cause any problems. This is a characteristic rash. These are petechial lesions that then become purpuric. Again, remember, they start in the hands and feet, like the soles and the palms of the hands and the feet, and then they work their way in. And there you see, again, the characteristic lesion, these petechial lesions and some hemorrhagic and purpuric lesions.